Hello, everyone. Welcome to my Policy Advocacy Social Media Campaign presentation. Today, I'm going to talk about the importance of drug prevention education for marginalized youth in Charlotte, North Carolina. And my name is Paige Hintz, and let's begin. So, drug use and overdose rates are increasing for African American and Hispanic residents in Charlotte, North Carolina. While the U.S. is currently seeing a decrease in overdose deaths, this is not the case for Charlotte residents who belong to African American and Hispanic populations. Since 2019, African American and Hispanic deaths caused by overdose has increased by 200% within the Mecklenburg County. White residents also experienced overdose related deaths, but that rate had only increased by 14%. This is a major gap that needs to be addressed to help ensure a healthier quality of life for members in our community. This is a screenshot from an article published by WFAE written by Elvis Minayis. This article is very relevant as it was published just this week on December 2nd. This article discussed an interaction with a man named Tim, who is a Charlotte resident in our community who struggles with drug use. Tim frequents the Queen City Harm Reduction Resource Center in East Charlotte, which is where this interaction was recorded at. Tim is African American. He's part of a racial group that has been disproportionately affected by fatal overdoses. In 2019, there were 54 reported overdose deaths among Black residents in Mecklenburg County. That more than tripled by 2023 when there were 169. Hispanic residents have also been hard hit. In 2019, there were 11 reported fatal overdoses in the Hispanic community. That number rose each year till 2023 when there were 42 reported fatal overdoses in that community. This evidence highlights racial disparities regarding drug use within marginalized populations at a local level. There are also concerning racial disparities that should be acknowledged regarding addiction treatment. According to Newsom 2025, African American residents are much less likely to seek treatment due to fear of incarceration. While drug use impacts people of all races, African Americans are unfortunately more likely to be arrested on drug charges in Charlotte, North Carolina. According to the website of Charlotte Mecklenburg Schools, there is a program put in place to help prevent the use of drugs for our youth, which is crucial during their development. The Comprehensive Health Education Program covers a wide range of information, touching on many public health topics, including drug and alcohol abuse. This information is covered in health and PE courses, which stands for physical education, and those courses are typically taught in the ninth grade. Sometimes students may have access to these classes at an older age after the ninth grade, depending on their schedule, but that is not as common. The problem here is that healthy values and habits should be taught at various ages to really instill the harmful impact of drug use in our community. Students need more education beyond a short unit about drugs and alcohol use, taught only in just one single class. By learning about this topic more frequently, impressionable youth may be less likely to develop an addiction in their life at some point. So, North Carolina does require their schools by law to teach about drug prevention. So, that's what we're going to talk about in this slide. This policy requires North Carolinas to teach the drug prevention in their schools, and here are some qualities that the education is supposed to include. The information should be taught in kindergarten through 12th grade, so it should reach students of all grade levels. The information and curriculum should remove and add recommended materials. Instruction should be age appropriate. The information should encourage health and safety. And the programs are supposed to be continually open to revision and improvement. So we don't really need a new policy. The policy that we have that is existing is good, but the application of it could be better. So, it says here that the programs are supposed to be continually open to revision and improvement. Well, I think that the current drug prevention education does need improvement. It needs to be pushed to the kids more, especially emphasized in those schools that have higher populations of historically marginalized people. So off to the right here, I have a screenshot of the law that you can read over as well if you'd like. if you are looking over it, you will notice that there does not seem to be any mention about culturally sensitive information. So that is something that should be considered maybe when speaking to schools with more diversity or populations of Hispanic people or African Americans. We should make sure that the information that is being presented is not over representing just white people. So there should maybe even be some review on this policy um, in a cultural lens as well. Decision makers of local education need to take action in order to create change. We need our local Board of Education to create a program that will implement drug use education across multiple grade levels with the intent of preventing students from engaging in drug use throughout their lives. This curriculum should be created in a way that is age appropriate, especially depending on the grade levels of the students. The curriculum should also be inclusive with considerations of being culturally sensitive, as Charlotte is a very diverse community. The curriculum can be taught through educational gatherings similar to pep rallies, where students are brought to the gymnasium by grade level and are presented with evidence informed discussions about the harmful effects of drug use. These gatherings should happen multiple times a year with discussions about different topics such as overdose, prevention, resources, reducing stigma, mental health, and healthy coping mechanisms. By developing a program like this, the intended outcome would be that the rate of drug use will decrease in the future of our community, starting with the influence of residents at an early age. So, the idea is that we really want to start having these conversations more with our adolescents that are still in school, hopefully, by increasing the amount of conversations that these students are being exposed to. That will also help reduce stigma. And, gosh forbid, in the future, if any of the adolescents that are a part of this program were to become addicted, hopefully, the reduction of stigma through this program will also encourage them to seek help in the future. A local news source, Axios Charlotte 2024, has covered information about the segregation of Charlotte schools. Even though segregation did end in 1964, there are still embedded effects that we can view in our system today. Some of Charlotte's largest schools still remain segregated in the modern day. And here are some examples of that I pulled from the Axios Charlotte article that is listed in my references. At West Charlotte High School, nearly 98% of the student body belongs to non-white populations. At South Mecklenburg High School, it is a predominantly Hispanic school with 44% of the student population belonging to Hispanic backgrounds. About 29% of the student population is white, and 21% are African American. Myers Park High School is predominantly white, with 56% of the student population being white, 20% of the student population is African American, and 17% are Hispanic. Dilworth Elementary School's student population is 75% white, another predominantly white school. With this information, it would be very important to especially ensure that predominantly non-white schools are integrated into this program to help decrease the use of drugs in Hispanic and African American communities. So who can help? Parents can help. School staff can help, such as teachers, the school principal. Addiction advocates can help. Public health advocates can help. Previous CMS students can be good advocates for pushing for better drug education programs. Social justice advocates and local treatment centers can also join the movement to push for better information. These are all people who can put the pressure on the Board of Education to implement better and more frequent drug education in schools. The reason that I've added previous CMS students is because I personally can vouch that I received very little information to prevent drug usage when I was in school. In the 7th grade, I remember learning about the harmful effects of smoking. This lesson was only taught once for the duration of a single class period. So it was very short, and I was exposed to it for a very short amount of time. I do also remember receiving a brief education about drug use in my health and PE class, which I did take in the ninth grade. This information didn't particularly stand out to me, though, because it was brief and it was sandwiched between many other topics of health. So I think by adding a more relatable tidbit here about my own personal experience can also be very useful. If I were to present this information to local decision makers, I would definitely include my own personal experience, and I would hope that would make it a bit more relatable and relevant to um, the community at a local level. So let's talk about a call to action. People who choose to advocate for better drug education in schools must spread awareness and education. Some action that can be taken would include contacting the Charlotte Mecklenburg Schools Board of Education. They could be contacted through letters, emails, or phone calls. Peaceful protests would also be great. That would also help to encourage local officials to implement a better education program preventing drug usage, especially in marginalized communities. Peaceful protests are also great because it helps bring awareness to the public community as well. It's also a good idea to bring awareness to social media through hashtags, further emphasizing the need for a local action on this matter. And we can also organize public meetings that would give more information about how a better drug education program can benefit our society. So here I created a mock-up Instagram page. It's called Parents for Prevention. Um, I have some little mock posts at the bottom, and ideally, those posts, if they were real, they would have a lot of different information for parents. In the bio here, I wrote Parents for Prevention is a group of activists with children in CMS schools. We are advocating for our community to decrease the use of drugs in marginalized communities. This starts with our youth, starting with education about drug use in their school curriculum. And I did include a hashtag, and the hashtag says Parents for Prevention. So I was thinking this would be a good hashtag to help spread awareness and maybe get other parents on this wagon. The idea is that this page would grow to be even more popular. The template that I used showed that this page would already have 596 followers, but the more the better, because the more people who are on board with this movement, the more that we can push for our local decision makers to make more informed decisions on how to help reduce this issue. So let's talk about the metrics. The results of this program would take some time in order to analyze the effectiveness of it. The use of drugs in African American and Hispanic populations would need to be further analyzed in the future, possibly 10 to 20 years from now, allowing the students in the program time to grow up in order to truly see the impact. While there may not be necessarily any sort of instant gratifications in terms of the results, it is clear that the current drug education programs that we have are not effective and that they are not thorough enough in the Charlotte schools. So, drug education within CMS has not changed since I was in their school system, and that was nearly 10 years ago. Um, this creates evidence that the current comprehensive health education program in CMS has been around for a very long time, and this further emphasizes that it does take a great deal of time to assess the effectiveness of drug education programs. One of the biggest concerns when implementing changes to programs and systems is, of course, money. So, what is the cost of these changes? Well, hopefully, volunteers will run most of this program. Volunteers can significantly reduce the cost of this program. Volunteers may look like parents, school staff, and potentially school students. Some school students might feel a little bit reluctant to help volunteer with these programs, but we could motivate the students by maybe offering them some extra credit if they were to volunteer with like the setup or any sort of planning that has to go into these new programs. These volunteers can help with planning, and they're able to set up for the drug education gatherings throughout the school year. Some funding may be needed in order to pay guest speakers, which may include experts from local clinics and treatment centers. Ideally, it would be great if the guest speakers could volunteer to speak. However, some speakers may require an hourly rate. if an hourly rate must be paid to a guest speaker, that will probably be the biggest cost once the program is actually put into place. And hopefully, the guest speakers won't have a large hourly rate, and we wouldn't need them for more than, some hours at a time. Nothing too crazy. So, who will facilitate the program? School nurses can get involved, science and health teachers, community experts, education board members, parents, and community health advocates. So, these are all people who can come together and talk about what works, what doesn't work. They could talk about their experiences, they can consult other experts, they can work together and collaborate to really try to make the best program that we need for our students. When should the program launch? Ideally, we would like to convince the education board to begin building this program now. If we can get decision makers to agree to drug education change, it would be smart to start planning in January. Planning would involve a collaboration of school faculty, local community experts, and the Board of Education. As long as there are no major roadblocks during the beginning stages of this program, it would hopefully launch in schools by the fall of 2026, which would be next year. However, it may take much longer to get this program into action. I'm sure that there will be some bumps, and it will take a bit of time to come to agreements about what this program will look like and how it will be implemented into the schools. But this all depends on the willingness of CMS to implement the new approaches to drug prevention in their schools. So hopefully CMS is willing. We have the evidence, the numbers are there, there is an actual issue, and if there are barriers with persuasion, hopefully this program can start no later than 2027. The sooner action is taken, hopefully the sooner we can start seeing results so that we can have a stronger, healthier, more equitable community. Here is a list of the 6 sources that I used to put this presentation together. Thank you all so much who have sat through this and listened. I hope everyone has an amazing rest of their week and a very relaxing winter break.